Top 10 symptoms of dehydration. What is dehydration? Dehydration happens when your body doesn't have as much fluid as it needs. That means your body can't function properly. Common causes include sweating, diarrhea, and vomiting. You can have mild, moderate, or severe dehydration. According to the research, more than 75% of Americans suffer from chronic dehydration. If left untreated, dehydration can lead to significant health problems, particularly for children or older adults. If you are an adult, the seriousness of your dehydration depends on how much fluid your body is missing. In children, dehydration is based on how much body weight they've lost due to a lack of fluids. 1. Thirst and dry mouth. A thirsty person is a dehydrated person. Dry mouth also frequently accompanies thirst. So if you are feeling thirsty or have dry mouth, take it as a sign you need to drink some water. However, you should continue to drink water even when you're not thirsty because it's possible to alleviate your thirst without avoiding dehydration. 2. Poor concentration and altered mental state. Not taking in enough fluids can take a toll on your brain and reduce your ability to concentrate. Some studies have shown that dehydration can be detrimental to short-term memory, concentration, and mood. A small study, including 12 men, found that abstaining from drinking water for 36 hours led to higher error rates on tests and negatively affected energy, mood, attention, and memory. Rehydration with water alleviated these symptoms. Many other studies have also shown that dehydration can negatively affect mood and cognitive performance in both men and women. Severe dehydration can lead to an altered mental state, which can seem like confusion and anger. 3. Dark-colored urine and low output. If you're not drinking enough fluids, your urine will be a darker color, and you won't pee very much. In fact, looking at the color of your urine is considered a practical way to identify dehydration. Darker colored urine can occur when your body is conserving more water and not releasing it into urine. For this reason, the urine becomes more concentrated with waste products from the body, like sodium and urea. The goal is not to have completely clear urine. Instead, the ideal urine color is a pale yellow, like the color of light straw. Keep in mind that other factors can affect your urine color, including the use of medications and B vitamins, which can turn urine bright yellow. 4. Dry skin, decreased elasticity, and cracked lips. One of the most common signs of dehydration is dry skin and lips and decreased skin elasticity. If you're experiencing dry skin, dry mouth, and dry or cracking lips, dehydration may be contributing to these symptoms. Keep in mind that dry skin and cracked lips can also be a sign of many other health conditions, so it's important to get the right diagnosis, especially if you're experiencing dry skin or cracked lips even when you're drinking optimal amounts of water. Healthcare professionals often use something called the skin turgor test to assess a person's hydration status. The skin turgor test involves grasping the skin on the lower arm or abdomen between two fingers and then releasing it after a few seconds. Hydrated skin will rapidly return to its normal position, while dehydrated skin will remain in a tented position and take much longer to bounce back. Decreased skin turgor is usually a sign of moderate to severe dehydration. 5. Fatigue. If you're dehydrated, you may feel more tired than usual. This is because dehydration affects every aspect of health, including your sleep-wake cycles. One study that included more than 26,000 Chinese and American adults found that shorter sleep duration was significantly associated with inadequate hydration, as well as that people who were adequately hydrated slept longer than those who were not. Being dehydrated can likewise make you feel more fatigued during exercise. One small study that included 14 male athletes found that acute dehydration of 3.2% body mass led to increased fatigue perception and also negatively affected exercise endurance. 6. Lightheadedness, muscle cramps, and weakness. When your body is dehydrated, it compensates by constricting blood vessels and increasing the heart rate to maintain constant blood pressure. The body also redirects blood away from skin to internal organs like the brain and lungs. However, this defense will begin to fail as dehydration worsens. Symptoms like lightheadedness, muscle cramps, and general weakness are indications that the body is failing to compensate for dehydration. 7. Heart palpitations. Being dehydrated may cause cardiac symptoms like palpitations, or a sensation of pounding, fluttering, or an irregular heartbeat. Not drinking enough fluids can negatively affect overall health, including heart health. According to one review, dehydration may impair heart function in several ways, including by negatively affecting blood vessel function and altering blood pressure regulation. Dehydration can also compromise heart function in people who are performing intense exercise in the heat. It does this by decreasing the amount of blood pumped out of the left ventricle of the heart and reducing cardiac output, the amount of blood the heart pumps per minute. 8. Headaches. When you're not getting enough fluids, you may get frequent headaches. Even though dehydration is strongly linked to headaches, researchers aren't exactly sure how dehydration causes headaches. One theory is that fluid depletion in the body leads to the stretching of blood channels in the brain, leading to headaches. However, researchers acknowledge that there are likely multiple mechanisms behind dehydration-related headaches, and that some people may be more susceptible to dehydration-related headaches than others. Some studies show that increasing water intake may help reduce headache symptoms in people who experience migraine. One study that included 256 women with migraine headaches showed that migraine severity, frequency, and duration were significantly lower in those who drank more water. 9. Dizziness. Dehydration may cause you to feel dizzy and lightheaded, especially when you stand up. Orthostatic hypotension is the medical term for a reduction in blood pressure when you stand or sit up. Dehydration can lead to orthostatic hypotension. This is especially common among older adults who are more at risk of developing dehydration and low blood volume, hypovolemia. Being dehydrated may cause you to feel dizzy and lightheaded, especially when you stand or sit up quickly. Severe dehydration may even lead to fainting in some cases, especially among older adults. 10. Low blood pressure. Low blood pressure is a sign of dehydration that only appears if a person is significantly dehydrated. As mentioned above, dehydration impairs blood vessel function and blood pressure regulation. Dehydration causes low blood volume, that is, a low amount of fluid circulating within your capillaries, veins, arteries, and chambers of your heart. When your blood volume decreases, your body compensates by increasing your pulse and respiratory rate, as well as by decreasing your blood pressure. Low blood pressure is a sign of severe dehydration, and it can be dangerous. Severe dehydration could lead to significantly low blood pressure, shock, and even death. Keep in mind that these symptoms could also indicate an underlying health condition unrelated to dehydration. If you're experiencing one or more of these symptoms, it's important to visit a healthcare professional for appropriate care. Preventing and treating dehydration. Water is the best thing to drink, while fruits and vegetables, because of their high water concentration, are the best things to eat. The body requires between 48 and 64 fluid ounces of water every day. However, people who sweat more need to drink more water to compensate. Electrolyte-added sports drinks are helpful for people in specific situations where the temperature is very high and the exercise is notably intense. Drinks with caffeine in them, as well as fruit juices, soda, and sugary drinks should all be avoided. Caffeine is a diuretic which causes your body to expunge fluids, whereas sweet drinks can be hard on your stomach when dehydrated. You can help prevent dehydration by taking breaks in exposure to high temperatures in cooler areas and wear light-colored, loose-fitting clothing when outside. Also, avoid alcohol consumption. Preventative approaches can be extremely effective. A good way to gauge how much water you need to consume when exercising is to weigh yourself before and after working out. Each pound you drop equates to a pint of water. The information on our channel is offered solely for general and educational reasons and does not replace professional medical guidance or treatment. For any ailments or medical concerns you may have, please get advice from a physician. Thank you for watching. Subscribe to our channel and hit the bell icon for more informative videos.